about like 2014 or 2015 when I was still a researcher. I'm trying to work with a clinical pediatric oncologist to help a 4-year-old girl from Texas with a brain tumor. So we're trying to launch the clinical trial to help use his technology on that patient. But after 2 years, we cannot make the drug and we lost that girl, and enough is enough. So BAMF Health is actually start from very like an easy idea. It stands for Bold Advanced Medical Future.
We're in this revolution of exponential growth in the space of theranostics, and the infrastructure in the United States and beyond isn't set up currently to enable that transition from a therapy that can be offered to millions and millions of patients. So we're very, very lucky in our molecular imaging clinic to have United Imaging total body PET CT, the uEXPLORER, and then the Michigan's first PET MR, the UPMR 790, and goes with BAMF's mission, seeking out the best technologies, focused on taking everything regarding molecular imaging, cancer and non-cancer imaging in general, and theranostics into the future. I always like to say we see what we treat and we treat what we see. And that's really a theranostics phrase at large. You have a diagnostic test that identifies a target, and then a therapeutic agent that is able to go and specifically address that target without impacting the body as a whole. Just as we do our therapy, as we do our PSMA PET scans for prostate cancer patients, so we meet with all patients the day after therapy, can visualize where the therapy went, and it's very impactful to then review that in real time and then to do that every several weeks. And we can make immediate treatment decisions based on the information that we're able to gather from these tests, using information from a PET CT or PET MR. So leveraging the best technology with the highest resolution to get answers and allow prognostication and predictability is very, very important. Having the technology from United Imaging allows is ensuring that every last cancer cell that can be visualized is visualized.
And a lot of people say that the total body PET is actually a research machine, and we don't see that way. We see there's a critical clinical value for our patient. Be able to scan the patients less than a minute is critical for a patient's care. And the patient have great comfort, great experience, and will acquire high quality information so we can move to the next step. Also, one of the concerns to the pediatric patient and prevent pediatric patients using PET technology for their neurological and oncological care is because we worry about the radiation dose gonna affect their future development, and also usually kid cannot stay still for long hours. Using these new scanners, we will be able to scan way faster, meaning we don't need to sedate the kids, and we can inject way less dose because it's actually way more sensitive and still achieve equal or higher quality. This opens up brand new applications to help the kids with oncology, neurology, or cardiology need.
And so it's a new age of medicine. It's a new way of delivering care more precisely, more specifically. It would not be possible without the amazing technology from United Imaging. It would not be possible without BAMF Health in this approach.
60 years ago, the whole NASA's computing power is not even like achieve one iPhone, but we shoot people to the moon. 60 years later, we have so many more technologies. We're willing to agree on one single mission to help the patients. We can conquer hard problems together. And that's the meaning of BAMF Health.